Hey, my name is Dr. Juan Santos. You are watching this because you are looking at counseling focused on your child, maybe one, maybe two. Yeah, it's a really good question. What to expect? Again, my name is Dr. Santos. I'm the owner of Santos Counseling, and I want to give you an idea, a perspective of what it's like to come to Santos Counseling and work with one of the counselors here, where their focus is on working with your child. So here's some items to expect. When working with your child, and I'm going to kind of pretend that I'm the counselor, but it could be any of the counselors here that are specifically trained. And we'll go into that area, specifically trained. Something that we do as a practice is we look at each clinician to ensure that they have specific training focused on working with kids, just like your child. And that could be training that focuses on play therapy, could be training that focuses on autism, on DBT, on CBT, and both of those are items that you could look up there. They're just different approaches when it comes to the clinical work that a counselor does with their patient. That gives you an idea that the clinician is trained, which I'll share with you as a father, as a clinician, a practitioner. I find extremely important that whenever you're working with somebody, let's make sure that there's some sort of training there, so that there's effectiveness of care. Now, when working with a minor, the first session, that's going to involve everyone coming in there, parent, whether it's one or plural, and then the child. One of the key reasons for that is consent, and we want to get a game plan. I want to get some structure going on to support the entire treatment process. Now, after that session, you're going to notice that your counselor is going to set up a specific structure for the goals. So you know why you're reaching out for counseling. You know what's happening in your child's life. And maybe your child has an idea. Maybe they're already telling you, I want counseling for maybe my anxiety, or I want counseling because I'm still maybe grieving or sad about something that's happened. So the counselor, they will work specifically with your child. And that's the client, if you will, the patient. Now, as a parent, right, you and I know something. You and I know that we spend, as parents, a lot of time with our kids, and our teachers spend a lot of time with the kids. So the counselor, what they'll do is they'll work with your child directly, while also including you, because you're going to have an interesting perspective. You're going to have your own unique perspective of what you see your child going through, how you saw them in the past, how you see them now, goals that you may have for them. So that's really, really important. And what that may mean, as an example, this is just an example, it may mean that the structure could be, we'll say, maybe a few sessions just with your child. And then the next session, maybe it's everyone together or just you. And let's just say if I'm the counselor, I'm doing that so I can ask you questions as a parent. I can say, hey, how are things going at home? Or maybe you and I can talk about a little bit of parent coaching, or we look at specific items that can improve areas of parenting. Because sometimes as parents, we're learning as we go. Sometimes as parents, we're reading material, but we're trying our best. And a great counselor, I think a great counselor is going to show up in a way of knowing what the goals are that your child's working on. And let's say an example of that is, let's say your child's working on social anxiety. Well, if your child's not driving, then more than likely that means the parent's going to have to be involved to some degree to help them with social activities. So it would make sense for the counselor, if I'm the counselor, for me to also have a session with you and then let you know what we're working on and how that can be supportive. Now, something to be mindful of in case you're thinking about it is that depending on the age, also depends on the involvement. If a minor comes in and they're 16 years old, maybe those sessions will focus a little bit more heavily just on them, versus if a minor comes in and they are 6 years old, maybe those sessions would involve a little more of that parent. And then that, more than likely that makes sense there. The last item that I wanted to go here is, I think and I'll share this as a parent, as a father, I think it's really important to ask questions. So when you reach out to us and you start counseling for your child, ask the counselor questions as far as, how can I help? Right? Is there anything on the parenting end that I can do? Having that relationship, building and establishing it, it goes a long way in supporting the goals that brought brought you, that brought your child to counseling. My hope is that this video answers some questions, maybe remove a little bit of that nervousness. We look forward to helping you.